David was kicking it off.
Yeah.
David, are you in
as the
control?
host.
Well, welcome everyone. Thank you for joining this meeting. And again, thanks to France for sharing some of her valuable time with us to talk about things that are meaningful to nurses, and particularly during this special week, National Nursing Week. And you know, over the past year, the pandemic has taken a toll, certainly on everyone, but I would say in particularly those within healthcare and nurses. They comprise a large majority of individuals in healthcare. So it's great to have the opportunity to talk to you, France, about our involvement in healthcare and in particular this pandemic, and how we see the future and how we've been able to manage and really be resilient over this past year. So thank you for your time. And perhaps maybe we could go around and introduce ourselves. I don't know if France knows everyone, but we can start with Morgan, who is our president, current president of RNAO, and I'll let Morgan introduce herself.
Hi, as David said, my name is Morgan Hofarth, and I am the current president of RNAO. I live in London, and I work in a long-term care home here.
Oh, wow. Pleasure to meet you.
You too.
Angela?
Hi, and France knows me very well, and so does David. I'm Angela Cooper Bradway, the immediate past president, and I just want to say Happy Nurses Week to all those of the nurses who are joining us today. And France, thank you so much for taking some of your valuable time to spend with us during Nursing Week and to learn more about what's happening in healthcare. And I know you know a lot about what's happening in healthcare, and we are so glad to have your support this year as you've been in the past. So welcome.
Oh, I always learn a lot when I meet with RNAO, so I'm looking forward to it.
Great. Matt?
Yeah, I'm Matthew Kelly. I think I know everybody, Director of Policy for RNAO, and to the nurses on the call, let me say Happy Nurses Week to you guys. Much respect for all that you do all the time. And to France, I know the relationship that RNAO has with you is incredibly valued by the organization, and the relationship you have in particular with the local chapter up in Sudbury there is a model for the rest of the organization. So everything you do in the legislature and outside the legislature on behalf of health in Ontario is much respected, admired, appreciated by all of us at RNAO. So thank you, France.
Oh, well, thank you. Thank you. I love nurses. You do?
Anne-Marie. Oh, sorry, go ahead.
Oh, hi there. My name's Anne-Marie, and I'm the Nursing Policy Coordinator. Welcome.
Pleased to meet you, Anne-Marie.
You too.
And last but not least, and I don't know if I've had the pleasure of meeting the individual who is left to introduce themselves, but perhaps you can introduce yourself, Ms. Steve.
Brenda, that's you.
Hey, sorry, I've got a couple of dogs barking outside the room. My name is Brenda Stade, and I just started today as an NP policy analyst. And I've been to Sudbury many times. My expertise, I'm a nurse practitioner. My expertise is diagnosis of fetal alcohol spectrum disorders and setting up planning for children and youth. And I've been up to Sudbury to help out quite a number of times. And my background is pediatrics and yeah. So that's me. I've been a nurse and a nurse practitioner for many years.
Great. Well, thanks everyone for joining this meeting. I do want to start off by thanking France, not only for her time, but so France has been working closely with our political and policy, for RNAO, working on a bill that she's introduced. And really this bill will strengthen and empower nurses and those who are working with some of the most vulnerable adults in their homes to address, various situations that they may find themselves in, abusive situations they may find themselves in. And certainly this was seen as a gap. It was identified by one of our own local university professors doing her research. We brought the issue forward to France, and France was able to actually move that forward into a policy tool. And looking forward for it to be introduced, and let's hopefully get through all the readings so that it becomes law. And from the bottom of our hearts, France, this is a meaningful piece of policy for us, and we think it's much needed, and you have been a champion. So, and you've always been a champion. Every time we meet with you, you know more about the topics than we do sometimes. So you're well versed in all the healthcare issues, and I think that speaks to your strength and your ability as opposition lead and health critic. So we do appreciate that relationship we have, and think that we want to continue to build on that. So thank you.
You're very welcome. I would say Maria Casa and nurses locally did the heavy lifting on that bill to make sure that we had support and that people understood what we were trying to do. And I agree with you that I think it would be a policy way forward that will protect a lot of vulnerable adults that right now have very little protection. I don't have anything against the police. They're there to protect people, but the bar is set pretty high to meet a criteria for the police to get involved. Meanwhile, many times nurses are aware that abuse is taking place, neglect is taking place, and they have very few tools to change this. And this is what we're giving them. We're giving them the tools to change it. It doesn't have to reach the point where the police is involved. If you suspect that there's neglect or abuse, then a team comes in, consent is given. We look at how do we improve the care and the life of this person. So the heavy lifting was done by all the nurses who worked on that bill. I was happy to work with them.
Thank you. And you're too modest. I did want to touch a bit about nursing and school nurses, school health nurses. So I know that the current government, this was last year, I believe, had announced, they initially announced for 500 positions within public health organizations. Actually, they announced for 500 positions. There was some advocacy done to ensure that those positions were within public health. And that the school positions could be leveraged within public health to address the pandemic. And I think that, RNAOs in its advocacy was able to leverage its strength and was able to sway the government in terms of ensuring that the positions were in public health, which I think is an important structural component. These nurses played a key role, particularly at the beginning of the pandemic and as schools opened, to help guide local schools, local families, and local administrators, school administrators, in how they can address and put in place mitigation strategies to combat the pandemic and to ensure safety of students. So this 500 positions turned into 625. Obviously, I won't say obviously, but I think it was quite evident at that point that there was a need for additional resources. So there were additional resources provided, and that was, I think that decision was based on per capita. But there was a lot of work done by those nurses. They did virtual presentations, in-person presentations. to the students in terms of understanding what COVID is, understanding what it means to be physically distant, to understand what it means to, wash your hands, how to wear a mask, all those important public health measures were explained to students. And not only students, but they were explained to the teachers as well and the administration. The nurses also played a critical role in helping the schools understand how they could improve their infection prevention and control measures. So IPAC visits were done with schools, not only post cases. So if there was a case in schools, the nurse would go into schools and do an assessment. But there was also IPAC visits done prior to any sort of cases to ensure there was a strong approach to reduce the risk of COVID in schools. And the nurses played a very strong role in that. Mental health was also recognized early on as an area where COVID could impact on individuals. So it's not just about a virus, it's about our ability to socialize and how changes and the mass number of changes that occurred within all of our lives impacted our health. So nurses also focused on strengthening some resiliency pieces, presentations on those things, what were identifying resources for the school community and help them in trying to address any sort of mental health concerns earlier on. And it's not going away. And I think I would say that mental health is still a concern. It's probably more of a concern now. We're heading into over a year of being within this pandemic, over a year of diligently following public health measures. So that means us, we might not see our families. We might not get to have social gatherings with our friends. And that really does take a toll on individuals. And I think that, if we look at the future, I think additional mental health resources will be needed and are needed. And I think nurses can play a role in navigating those supports for individuals. What else? Also say that the nurses played a role not just within the school, but they also supported this whole school community. So as an example, there were a number of complaints, I would say, that children were congregating outside of school. There was concern from local community members, and really concern for the students and concern for the the community itself, in terms of how is the children congregating going to impact the spread of COVID. So public health nurses also worked with the school administration, worked with the school teachers, worked with the parents, worked with the police, strategizing on how can we address this together. And so develop messaging, again, presentations with schools, with students, with parents, to try and hit home some of the messages that were critical in terms of the importance of physically distancing. And at that point, I think we were talking about bubbles. So the importance of staying within your bubble and that sort of thing. And they continue on. And I would say for the past little bit, I would hazard a guess that the school public health nurses have been focusing in on case and contact management. We've had a third wave. There's been a great deal of cases across the province. And I am certain that those nurses also contributed greatly to the follow-up, the case contact follow-up, to ensure that we're containing the virus and mitigating the spread. So those nurses have played various roles throughout this whole pandemic, and I would say that that role is a role that should be maintained within the foreseeable future. And I know it's a significant investment, However, I do think that's a critical investment at this point. And I'll stop there and maybe open it up to comments, questions.
Can I ask a question?
Yep.
David, France, the Minister of Education made an announcement last week. It was $2 billion worth of funding for various things, and it included 86 million for school-focused nurses in public health, I think is the way they phrased it. And I'm wondering whether you know whether or not that's a continuation of the funding for the 625 nurses that were funded last year. And a second part of this question, we had supported the Anishinaabe Nation for community wellness nurses. So when they saw the funding go out for the 625 school nurses, they said, well, that nurses located in the school doesn't actually fit our community, which is more remote. We need the kind of equivalent or analogous nursing in our communities. And so the government funded another 50, I think 50, maybe 60, what they called community wellness nurses for NAN. And so part two to my question about the 86 million is whether you know whether or not that 86 million would also include those NAN community wellness nurses, if indeed it is a continuation of this public health nursing in the schools.
So all I can tell you is that I took it as being the continuation of the nurses both in the school and with NAN. I will have an opportunity to ask the minister directly if my assumptions were right. They never went into any more details as to what it was. I looked through the estimates book, which the estimate is all the money that the government intends to spend in healthcare. And this is what I assume it will go to. But estimates for health starts tomorrow morning at 9 o'clock. And we have 15 hours of it booked. So between when we start and when the 15 hours end, we should have a more direct answer on where the 86 million for school is focused. Right now, in everything that I have read to prepare for estimates, everything leads me to believe that it is a continuation of the public health nursing positions that were put into the school, and that it would include the nurses, the community nurses that were helping within the NAN territory. But I will, so right now I would say that I haven't seen anything else, but it is on my list of questions to ask the minister. So once she answers the questions, we will know for a fact.
Thanks, France.
Great. Any other comments or questions?
Yeah, I have a comment, Fran. We're all aware of the commissioner's report that came out last week, and included in it is the basic guarantee care for long-term care, the 4 hours. So I would like her to follow up with the minister, not only the minister of long-term care, but health and with the premier, if they're committed to implementing this basic guarantee care for people in long-term care and residents.
They have voted in favor of 4 hours of hands-on care. They are on record numerous times to saying that they are committed to implement a minimum of 4 hours. No, they don't say a minimum. An average of 4 hours of hands-on care per residence is the language that they use by 2025. So they are on record. We've asked these questions numerous times, And the answer is always the same. We say a minimum of 4 hours of hands-on care. They say an average of 4 hours of hands-on care. We say we need it now. They say 2025.
As you mentioned that, I got a report from my MPP Lawn Co about a better place, a better home. And in that report, it mentioned they're going to implement it in 2024. And we give feedback on that report and saying it's needed to be implemented now. This is the government to implement it now, because if they don't, there's no guarantee the current government is going to be in power in that time. And who knows if it will ever be implemented. Our population is aging. We have more older people in the country, and in Ontario, particularly the larger province. And yet we don't have a firm commitment to implement something when you're not sure you would be the governing government. Then, you know, it's just promises. It's just vain promises.
I agree with you, but I also don't make promises that I can't keep. I was elected in 2007. At the time, I basically pushed for 3.5 hours of hands-on care. We're now in 2021. The reports that have come out of the commission says that we're at 2.25 average hands-on care in our long-term care home. We were higher than that in the year 2000, when there was, at the time, the minimum hours of hands-on care were 225, but because there was a minimum hours of hands-on care in law, every long-term care home had to report. So I use every 3 months, I would send a freedom of access of information and see for all 620 something homes where they were at with their average hours of hands-on care. And lots of them were into the 325, the 350, the 3. So when you'll remember in 2007, the Liberal government passed the new Long-Term Care Home Act. They did not want to put a minimum standard of care in legislation because they say it could change. We'll put it in regulations. They never did that. Now we have nothing. And although the acuity needs of every single resident of long-term care has gone up, the level of care has come down. And we have a government that says, yes, 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 it's important to bring it to 4 hours. In they used the 24-25 budget year.
And another statement that the present government made that is worrisome is moving ill patients from the hospitals into long-term care, when long-term care is underfunded, understaffed, and they're going to bring sick patients there. Where are they getting the staff to care for those people? And they're going to increase the workload of an understaffed sector by bringing people from the hospital there.
Absolutely, not only into long-term care, but they're also discharging a lot of sick people into overflow beds that could be in a hotel. Lots of them are in retirement home. Some people are being transferred into long-term care. None of this is quality care. None of this is what we would want for our loved ones or for ourselves. You all know that we have to do better than that.
Yeah, I'm just going to jump in there for a second, Angela, and I know that we only have 4 minutes left, but I think that really speaks to that we need a robust health and human resource plan. Mm-hmm. And I think that's been lacking for, a number of years. This pandemic is going to take a toll on our nursing workforce. It already has. We need to ensure that we have a strong and viable workforce now and into the future. And I'm concerned if we don't plan for it now, we won't have that. And it needs to be robust because there are a number of areas that really need attention. Long-term care is one, but we need community care. We need nurses in the community. We need nurses in specialized areas like ICU. We need a better way forward, and we need to find it, and we need to find it soon.
And I just want to build on the comments about long-term care to say 4 hours of care per resident per day is great. But I think we need to really think about this skill mix. And when you look at the increasing enrollments that the current government is looking at planning, if there's been a lot of focus on PSWs, and PSWs definitely are needed in long-term care, but there also needs to be an increase in enrollment for both RPNs and RNs. And I would argue sooner than we increase the enrollment for PSWs, because it takes longer to educate those groups and to have them prepared to practice. So that's something that I think we should be being mindful of, is looking at the enrollment for both the RPN and the RN program and increasing those so that we will have the workforce ready when we do move towards increasing the number of hours of care for residents in long-term care.
Agreed. In my community, we're going backward. Laurentian University is cutting a whole bunch of programs. They've cut their placement coordinators and all their labs and all of their support to our nursing program, which you all know it is not easy to become an RN. You need a lot of knowledge and skills, and this knowledge and skills comes from the people in the university who supports you, who gets you ready for your final exam. Well, we're losing all of that in Sudbury. So I'm ashamed of what's going on in my community, but I'm also very afraid for what will happen to all of those student nurses who won't have the support they need to make sure that they graduate and they pass the final exam and they join the college. All of this is at risk right now in my community, when I fully agree with you that we need more, not less. I mean, RNAO has the stats as to the number of RN per populations. We are number 10. We have the least.
Mm-hmm. Yeah, and I think actually in all these areas, Franz, it's so important that we look at the balance of all of the sectors in the healthcare system. I'm sure you're well aware of our ECHO report, and we need a strong system anchored in primary care where there's strong public health, strong long-term care, strong home care, as well as the hospital sector. But it can't be the only sector that takes over everything. That is not how successful health systems are run. So that's also something we continue to champion for, as I know you know.
Oh, absolutely. I mean, Ontario health teams are moving forward. You all know you need a hospital, long-term care, home palliative care, community care, mental health, and palliative care, home and community care. So there is a David and Goliath in there. We all know that the only one that is big enough to be able to supervise all that is our hospital. Yet we all know that the hospital is not how we should lead our healthcare system. I mean, home and community care will continue to suffer. Primary care will continue to suffer. And if we don't invest in those parts of our healthcare system, more and more people will get sick and end up into the hospital. Elderly people want to be supported and respected in their own home. That means a robust home care system that is there on time, that has dedicated nurses whose profession and career is to provide good home care. But right now we have a whole bunch of private for-profit home care system that cannot recruit and retain a stable workforce because they don't provide good jobs. And I could go on and on. So with the health teams being put into place and no guarantee that, if all the money goes through the hospital, I'm really afraid to see how many pennies will make it to outside of the hospital into home and community care and primary care and into all of the other parts of the healthcare system that would support people where they want to be supported rather than let us get sick and then get care in the hospital.
Absolutely. I don't think you're going to get any arguments from us on that. It is 4:02, France. I know that you were only able to give us a half hour, so I do want to keep us on that time. I want to thank you for your time and I want to give you the last word. So is there something that RNAO should be doing to strengthen our healthcare system that you know of? And is there some way that we can support?
Oh, absolutely. When RNO takes a position, when you speak up, you speak from a position of power. People trust you. You do your homework before you come out with the positions that helps our healthcare system. Right now, it's really to support public health, to help us navigate out of this pandemic that we are in. Don't get me wrong, I am no better, no worse than everybody else. I am tired of being at home, of speaking to my kids on the phone and not giving them hugs and all of this. I'm just as tired as everybody else. That just shows how we need to take our directions from public health, not from politicians. Not be the leader in this. Nurses and public health experts should be the leader in that. And RNAO giving their support to public health and echoing the message coming out of public health carries a lot of weight. It carries a lot of power, and it helps all of us. So I would say one, and second is to keep an eye on the Ontario health teams. I have nothing against hospital. They do a good job, but we all know that this is not where Ontario needs to invest. Ontario needs to invest in other parts of our healthcare system so that we keep people healthy, whether we talk about health promotion, disease prevention, primary care, secondary prevention of people with diabetes or other chronic diseases. RNAO knows all of this. You have a strong position on this, and as soon as the pandemic leaves us, we have to focus back on this before all of healthcare will be directed at either hospital or big long-term care home. They will be in charge of our healthcare system, and I'm afraid what that will look like and what that will mean.
Well, you're not going to get any arguments from me. I've dedicated almost my whole career to public health. So you're singing from my song sheet, and appreciate that, France. I want to thank you again, France, and everyone for joining this meeting. Really appreciate your time, and look forward to meeting you perhaps in person, face to face, and hope you keep well and take care of yourselves. All the best.
Thank you. Thank you very much. And thanks for RNAO for everything you do, and happy Nursing Week.
Thank you very much.
Thank you.
I know.
Bye-bye.
Bye-bye.